Alrighty laddies, I'm Dr. Jacksepticeye. I'll be filling in for a friend of mine today. And are you all ready to take out a gallbladder? I think so. Is that what we're doing? Gallbladder? Yeah. Laparoscopic gallbladder. I don't know. Of course I know what that is. I am real doctor, not cornflakes doctor. So let's scrub in. I hope we get to see our old pal Dr. Susie. If I have to see Dr. Jeff even once, I'm gonna freak out, okay?
Hello,
Hey, there
and welcome
she is.
to Surgery Squad's virtual laparoscopic
Dr. Susie!
cholecystectomy. I'm Dr. Susie.
Good
and
to
I'll
see
be
you,
guiding you
Suze.
through this procedure today.
Okay.
Your gallbladder is basically a place that stores bile generated by your liver. As your body digests fats, your gallbladder pushes bile into the common bile duct, down to your small intestine, to help digest them.
Thanks,
Gallstones
gallbladder.
form when the bile hardens into small pieces that
Don't you hate it when your bean pod and you got too many beans in it? Me too.
block the common bile duct. These stones can consist of calcium, blood, and cholesterol.
They look like toffee popcorn. Can I have some? Can I go watch a movie and eat some gallstones?
And they can cause moderate to severe pain, along
Okay,
with
no, never
nausea
mind.
and or vomiting.
No, cancel the gallstones. I don't want them anymore. Just regular popcorn will do.
When this happens, it is called a gallbladder attack.
Salted!
Gallbladder removal is the best treatment for gallstones. There are two types: open gallbladder surgery and laparoscopic cholecystectomy.
Can we go with the one I can pronounce? The gallbladder surgery instead of laparoscopic cholecystectomy? Hey, I can pronounce it! Haha, real doctor. Okay, let's get into it.
Open gallbladder surgery involves one large incision and removal of the gallbladder.
Okay, sounds simple enough.
It is performed when the laparoscopic method is not possible, or when complications or too much scarring from previous surgeries are found.
Yeah.
Or when the patient's blood won't clot well.
Fucking
This type
hate
of
that.
surgery causes more pain and longer recuperation time.
Okay, what's the
A
other one?
laparoscopic cholecystectomy, however, is
Haha, you struggled too. You sounded like you couldn't even say it there for a second. A laparoscopic cholecystectomy, Susie. It's okay, I'll train you eventually, but just for the sake of learning, let's keep listening.
the most common and often the best method to remove a gallbladder. It is where the gallbladder is removed through several small cuts in your abdomen. The surgery is safe, and folks who have it normally recover within 1 week.
Damn.
There are a number of benefits to having laparoscopic cholecystectomy.
Ooh, is that a belly?
Among them, you'll be able to eat food without pain in most cases.
More than 500,000 people undergo gallstone surgery each year? From where? Also,
It eliminates any discomfort in the stomach lining, and in some cases, it relieves your upset stomach.
Oh,
However-
yeah. My stomach is really sad lately. Because I can't eat much. It just keeps crying all the time.
If you have your gallbladder removed, you might experience chronic diarrhea, indigestion, trouble digesting, severe liver problems, fatigue, and rare but intense abdominal pain.
You might also feel like that you need to sing Elton John songs at the top of your lungs every 4 minutes. That's normal. That's part of the recuperation process. Just go with it.
The patient waiting
Oh,
for
God!
us has been suffering from pretty severe gallstone pain.
He's also
so it
been
is
suffering
imperative
from
we get his
severe
gallbladder
case of
out.
ugly.
Let's scrub up and get going.
Okay, he looks very angry that I'm about to perform
Patient is
surgery
already
on him.
under general anesthesia, thanks to our nurses and anesthesiologist. We're going to make 4 small incisions, 1 right below the belly button, and 3 others right over the abdomen. First, we'll disinfect the area where we're going to make our first incision.
I have to pee on it, don't I? Of course I do. Okay, he's got general anesthetic in him. A little for him, a little for Jack. Whoa! Okay, it's ready go time. Here we go. There we go. Just swab it all. I'm swabbing. Why won't you let me swab the other area? Come on, this is swabbed. I did it. Let me swab the others.
Good. Now take your scalpel and make a small incision right below his belly button.
Okay, oh fucking Jesus! I didn't even click that, you just did it on your own! Hold the phone! I actually didn't disinfect him, I was joking! It's a little doctor joke, that was only orange soda that I put on him! Oh, this is bad! Oh, Derek! Okay, this is not so bad.
Nice and clean. We've got to see where we're going, so we'll first inflate his abdomen with a little carbon dioxide to have some room to work.
I'm sorry, but what? You did not say any of this at the start. Small incisions that you were talking about. And you were like, perfect. And then, bloop, you stuck a big old tube in them and now we're stuffing them full of CO2 inflation? Dr. Susie, I don't know if you're a real doctor. I think you're some sort of criminal mastermind.
Just right. Now we'll use this laparoscopic camera to help us see where we're going. We'll watch our monitor as we go.
Okay, steady as she goes. It looks like I'm holding a wand. Abracadabra. Make these gallstones disappear. Oh, tap, tap. See if we can find a hidden rabbit.
Slow and steady. You're doing a great job.
Oh!
And there it is. I'll take care of the other incisions for our laparoscopic tools. Now that all of the trocars are in place, can you move the liver out of the way using the clamp so we can get to the gallbladder?
I sure can, Susie. Hey, hey, liver. Could you just move it on up here out of the way for a second? Oh, God, it's an alien.
Work. We should have plenty of room to work now. Before making any incisions into the gallbladder, we'll need to clamp off the bile duct in 3 locations.
That's a chest burster! It's alien! Susie! It's gonna explode! Okay, clamp, clamp. Ooh. Snip, snip, clamp. Ooh. Clamperoo. Give him the clamps!
Right. Now use the scissors to sever it.
Oh, why? Why? Why, Delilah? Oh, sorry, dude. Sorry, I know you have a big serious case of ugly. We'll fix that afterwards, but right now, I gotta snip you. Ooh, a little
I'll
balloon.
hold the gallbladder in place while you work to cut it from the liver. We'll use an electrocautery device to minimize bleeding.
Sure. Can I ask what the point of all the other incisions are for this stuff? Oh, I get it. Okay. Burn it away. Oh, God. Oh.
Fantastic. Looks like you've done this before.
Smells like bacon.
One last thing. Let's take our clamp through the cut under the belly button and pull this guy out.
Oh, this, I have seen a Ridley Scott movie before. Oh.
Nice work.
It's out.
Our scope shows that everything's clean. We've removed the gas, so let's close him up and get him to a fast recovery.
Okay, wait, what? That was it? Do I not need to put that thing back in? I'm sorry, I wasn't paying attention in the middle of all the alien stuff that was happening. We shouldn't have taken that out. Now we're gonna die.
Our patient is now in recovery, and he'll probably be there for a few hours.
Who's this? Hello? Getting your gallbladder removed. It turns you from a 2D animated character into a real-life human boy. That's all Pinocchio had to do.
We'll send him home when he's able to eat something and drink fluids easily. We'll also make sure he can walk on his own before we let him go.
We'll also make sure he's the same patient that we had the first time.
And his doctor will probably have him on a special diet to follow for a few days. He should be ready to resume a normal life after a couple days of taking it easy.
I don't know if you can ever have a normal life after you remove an alien from your belly.
And that's how we perform a laparoscopic cholecystectomy.
We did it!
You did a great job today.
Thanks.
While you're here, try your hand at one of our other surgeries here on surgerysquad.com.
I think I will, but maybe not one of them's. I think we're going to lighten up and remove some hair today.
Welcome to Surgery Squad's
Fucking
virtual laser
Jeff.
hair removal. I'm Dr. Jeff.
Hi,
and I'll
Jeff.
be assisting you with this surgery today.
Do you have to?
Everyone gets hair where they really don't care to have it.
You're telling me, Jeff. Haha, in between my toes. Not the best place for hair. I like to have airflow going through there. Airflow, not hair flow. That's my motto. So let's remove all that unwanted hair from our bodies. Let's see how this is actually going to go. I can remove gallbladders. I can give birth, bring life into the world. I can whiten teeth and I can remove hair. I'm a doctor of all trades. That's why they call me Jack, because I'm a jack of all trades.
Fortunately for all of us, we have the option of laser hair removal.
That's not what that is.
Laser hair removal is a non-invasive cosmetic procedure that uses a laser to remove unwanted hair.
That uses a laser from space to blast a hole in your sternum.
The energy from the laser damages the hair follicle, which reduces the hair's ability to grow.
Haha, fuck you, hair.
Although laser hair removal is an incredibly popular procedure, not everyone is a good candidate.
Woo!
The best candidates are those who have hair that is darker than their skin.
Okay.
Individuals who have a darker complexion or lighter colored hair may have their skin inadvertently damaged by the laser.
Yeah, that's what happens when you show too much nipples. They get blasted off. Don't show your nipples. You will get scars and you will die.
These individuals may also need more treatments to get rid of the unwanted hair. Our patient today is a male in his 30s that wants to get rid of some unsightly back hair. As you can see, he is an ideal candidate since his hair is darker than his skin.
That's his chest. That's
I've
his
already
head.
given our patient special goggles to protect his eyes from the intense
The goggles, they do nothing.
light that is emitted from the laser. To get things started, we first need to shave the treatment area.
But then, it's on his back. This is laser on his back, his eyes face forward. What's he doing? Hey, what you doing back there? I don't know. Okay, let's put this fucking Barbasol on him. Oh yeah. Oh yeah. It's gonna be a white Christmas in town this year. Oh, this is gross. Why do I fucking have to shave this hairy back Mary? I don't want to. Okay, there you go. Now you look like clouds. Oh, Jesus, there's more. Did they call you the fucking silverback of the West? I imagine they do. I'm gonna call you Wildebeest. Is that okay? Wildebeest William. I know I'm not supposed to shame my patients, but seriously, I went through 3.5 cans of fucking shaving cream. What does that tell you? Oh, mother of Christ, there's more! Cindy? Yeah, cancel my 5 o'clock for the next 4 years. We're gonna be here for a while. Yeah, I have to shave William's back. Yes, that William, the walking carpet. I know, I thought he was wearing a jumper as well. What are you gonna do? Don't let there be more. Don't let there be more. Okay, here we go. Oh, sweet Jesus. Oh, there we go. Nice and cleanly shaven. That's not how razors work. You can't go forwards and backwards. Can't you just do this every now and then, dude? Can't you just get someone who loves you to do this? Lord knows I don't. I am not getting paid half enough for this. Okay, I did not go to Kellogg's School of Doctor College to be treated this way. It doesn't even do it properly. You see this? I'm gonna need some sort of like dagger or sword or something to get rid of all this. I've gone through 16 packets of disposable razors by now.
Great. Next, let's apply a topical anesthetic to the treatment area to reduce the amount of discomfort our patient may experience.
Okay. There you go. I'm not being as liberal with this one. Okay? Because this is the anesthetic. It's not an ointment. So, because I just felt a bunch of pain having to shave your back, I need you to feel a small bit of pain as well, emotionally, from this. And physically.
Now that the topical anesthetic is applied, we'll need to wait about 30 minutes or so for it to take effect.
I just go up and slap his back
The
now.
anesthetic has set in. It's time to zap some follicles. The most important step of laser hair removal is to get rid of the unwanted hair using our laser.
The most important step of laser hair removal is to go in through the anus. That gives you better access to the hair follicles.
As you guide the laser over the treatment area, it shoots tiny bursts of energy, which
The sun is a deadly laser.
travels through the skin and is absorbed by the hair follicles. By doing this, we're damaging the hair follicle and reducing any future growth. Why don't you try it out?
Oh, yes! Well, this is lame. I sound like I'm just scanning barcodes on his back. Yeah, Weight Watchers beans. Yep, cup noodles. I'm real, doctor. I swear. Beep! He's dead. There's nothing I could have done. He had too much hair. I shaved it all off and he died of blood loss. Okay, here we go. Super speed. Are you ready to see a fucking real doctor in action? Watch these magic Mike fingers go to work. Yeah! They call me Dr. Morse. Oh yeah, I just spelled out SOS. Please save my soul on your back. There, perfect.
Perfect.
Hey!
Are you sure you haven't done this before? After the procedure has been completed.
A bunch of dots everywhere like a fucking octopus got at him. It's like, perfect! You sure you haven't done this before? Pretty sure.
Our patient's skin may appear red or irritated. Luckily, this lasts only a day or so. It's extremely important to avoid the sun or use sunblock for a few weeks after the procedure.
So does everywhere,
and avoid
dude.
any plucking or waxing of the treatment area.
Wait!
Immediately after.
Why would he have to pluck or wax the treatment area? I just removed all the hair from his hairy back. Jeff don't make no sense. Jeff's not a real doctor. Jeff doesn't know what he's talking about.
The treatment, our patient can apply cold compresses to the area to help alleviate any discomfort. Within a few weeks after the procedure, he may notice some new hair growth from the treated hair.
Yeah, because the amount of hair he had cannot be stopped. That is the unstoppable hairy man right there. The amount of hair on his back rivals that of a silverback. Hence why I was calling him Silver Joe earlier.
Follicles that were inactive at the time. Because of this, our patient may need to undergo multiple treatments. Most individuals receive a total of 6 to 8 treatments before achieving desired results.
Oh, would you look at that? I'm busy on all his appointments. Too bad, you're gonna have to get Susie to do it. Now that we shaved a whole Serengeti's worth of hair off that man, it's time to see where his hair is about to go. It's time to see where he's donating all of this hair. We're about to do some hair transplants. So he had enough hair to cover the heads of 15 million men. So we're gonna see who's up next.
Welcome
Susie!
to Surgery Squad's virtual hair transplant.
We missed you!
I'm Dr. Susie, and I'll be assisting you with this surgery today.
Yes!
A hair transplant is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body,
Known as a different person. Because we just took it off William, and now it's going on to
known as
Jim
the
over here.
recipient site. Although hair transplantations are typically used to treat male pattern baldness and restore eyebrows, beard, or chest hair, they can also be used to fill in scars caused by accidents or surgery.
Ah!
Today, we'll be using the strip harvesting method to treat our patient's male pattern baldness.
Okay.
Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head.
Ugh.
Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids.
I get it.
Alcohol use and smoking before and after the surgery can also result in poor graft survival.
Yeah, but I'm allowed to drink and smoke during the surgery, right? Because that's how I work best. Cigar in one hand and a scotch in the other. That's how I get a steady hand.
To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help prevent any infection. I think you can handle that.
Susie, are you saying people who shampoo hair for a living are beneath you? I think you can handle that. Dr. Condescension. Okay, here we go. Oh, I should have spelled out my name. That would have been cool. Okay, sir, we're gonna shampoo your hair, right? That's what we're going to be doing right now. I'm a doctor, I know how to shampoo hair, apparently. I didn't go to save 17 years of doctor college, medical school, to learn how to shampoo hair. I can try and work up a good lather. Oh yeah, sudsy boy. Oh yeah, frothy froth.
So fresh and clean.
So fresh and so
Thoroughly
clean,
rinse the
clean.
patient's hair, and we're ready to get started.
Ah, there we go. Let's wash away the badness. Let's. It wasn't that he was missing hair. His head was just dirty. Here we go.
The next step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
Go ahead and draw on that motherfucker. Okay, maybe a little down here. Up there. Over here. Down there. He's an Illuminati hairline! Do you think we can do this? Is science caught up enough to be able to perform a hairline that well?
That looks good to me.
Don't fix my line, Susie!
Let's prepare the donor site. We'll begin by trimming the patient's hair in that area.
Oh, yeah. Oh, there we go. There we go. Nice! And I'm shaving the entire back of his head. I did it!
Now that the patient's hair is trimmed down, we'll need to mark the area that we'll be removing.
Oh, this is gonna be weird. This is gonna be weird. This is gonna be weird. I don't want to remove some scalp. Ding! I did it! I call this one the Crossroads.
Great job! Inject local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience.
It's like when you have a child and they color in a picture and it's just an absolute mess. Like someone took a Van Gogh painting, ate it, and then vomited it back onto paper. And then you're just like, well done, sweetie. It's amazing. It's like, I have no idea what it is. I think my child's possessed. Can somebody call a doctor or a priest? Okay. Stab. Stab. Ooh, not liking this one, Jeffrey.
Great, he won't feel a thing. Now we'll need to remove the piece of scalp we outlined from the donor site. Use the scalpel and cut along the line to begin the process.
Is that why it's called scalpel? Because it scalps people? Oh, I get it. Oh, God! Oh, playing doctor was a lot more fun when I was a kid. Ooh, it looks like a smiley face in the back of his head.
Next, remove the piece of scalp from the donor site.
Oh.
Make sure you have a good grip.
Make sure you have a good grip, or you might end up pulling his whole entire brain out of the back of his head. Ew, 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 it's like wallpaper. Did you have to make the sound?
Once removed, we'll prepare the piece of scalp for grafting by dissecting the individual follicles.
Couldn't we just have put carpet on his head?
Why don't you go ahead and suture the donor site?
Oh, yeah. Okay, here we go. Oh, perfect. Look at me go. Look at me go. I'm doing it with no hands. I'm amazing. I'm the world's best doctor. The world's first telekinetic doctor. Watch me go. I will. This wound closed. Let me just put a bunch of little lines on you. There we go. And last but not least, God, I'm very, very slow at this. I should make myself a sandwich while I'm suturing all of the back of your head. Sorry about that, by the way. It's okay, you got a bit of a neck lift at the same time. Oh, that saggy neck, gone. Out the window.
Great, let's get to some dissecting. The first thing that we need to do is cut the removed scalp into sections.
Oh!
We'll dissect this one section of skin while our medical assistants take care of the others.
What do you mean dissect?
Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor.
What the fuck? I didn't know this is what you did. This is weird. Oh! Oh, it looks like cheesecake. Very hairy cheesecake. Don't like it. Don't like it.
Nice job. This step is repeated thousands of times to get each follicle prepared.
Really?
I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the scalp.
So do you do this like follicle by follicle by follicle by follicle by follicle by follicle? That's so tedious. It's not worth it.
We don't want our patient to be uncomfortable.
Sure, we don't want it to be uncomfortable, so let's stab needles in his head. There we go. And there we go.
Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp.
Okay.
Use the microblade to make the incisions in the recipient site.
Ooh, the microblade. Are you serious? Oh my god, you're a human pincushion.
Perfect. With all of the incisions, it's getting a little messy there. Let's get that cleaned up.
It's getting a little messy there. I shouldn't have eaten my french fries and ketchup over the top of the procedure. Don't worry, I'll mop it up with my McDonald's napkin right here. There we go. All clean and bloody again.
Much better. Use your tweezers to pick up and insert the hair grafts into the recipient area.
Oh my god, this is the most tedious procedure I have ever seen. I had no idea that they had to do, like, I don't know what I thought. I thought it was like laying down AstroTurf or fake grass, where you could just lay down a roll of it and it just tuck to the skin, or use a special method to get it to go in. I didn't know you had to put in each individual follicle.
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site.
So tedious.
After the procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections.
He'll also be prescribed to stay away from his family and friends because they'll know that he got a hair job because the hair is tiny little follicles now.
For up to a week after the procedure, the donor area may be sore and some numbness may be experienced
Looking
as well.
good, my dude.
Our patient can also expect moderate swelling and redness during this time. Shampooing of the recipient area is typically started 2 days after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost.
Man, that's a pain in the
In about
ass.
10 days, our patient will return to have his sutures removed. During the first few days after surgery, almost all of the transplanted hairs will fall out due to shock loss. Shock loss occurs when the hairs are traumatized by their relocation.
Why did I go through all that effort if his fucking hair's gonna fall out again anyway? You better have some good news after this, Susie. Please tell me there's a redemption arc. Please tell me the third act of this story is a happy ending.
Within 2 to 3 months, the patient can expect new hair to begin to grow from the treated area and continue to thicken during the following 6 to 9 months.
Not only did we give him new hair, and that looks amazing, we gave him the Hasselhoff, we also gave him a brand new mouth. Look, this one has a smile attached.
And that's hair transplant surgery. Why not try your surgical skills in another surgery here on SurgerySquad.com?
Oh, you know, I would, but I'm about 4 follicles late for a different thing that I want to do more than this. Okay, well that does it for more surgeries. I hope you all learned something here today. I learned that hair transplant surgeries are so tedious and they take forever. But I also learned that I'm amazing at them and I can do whatever the hell I want because I'm the world's best doctor. But for now, thank you guys so much for hanging out in my ER this time. I don't know who actually let you in. It's really kind of a hazard, but you're watching a master at work. If you liked it, punch the like button in the face like a boss. And I paid the road. Whoosh, whoosh. But thank you guys. Now we'll see all you dudes in the next video. Hair removal? Transplant? Anybody? I got the moves.